Hello friends, I'm Dr. Kuber from Pune City, Maharashtra, and today I'm going to talk about the insurance in circumcision, frenuloplasty and redo circumcision. So we are covering 4 to 5 topics today in this short video. First is which diseases are covered under insurance for circumcision, frenuloplasty and redo circumcision. Then the types of insurance, that is individual and corporate. Then the network hospitals and pre-authorization process, doctor's first consultation, initial approval, surgery and final approval and discharge. So I will get you in the video step by step how to proceed with the insurance. So first topic is which diseases are covered. According to overall general insurances, medical insurances that are cashless insurances in India, most of the congenital diseases of the penis are not covered. That you should know, like phimosis, frenulum breve are not covered for the cashless approval. So you should always remember that these diseases are not covered, but the covered diseases are the infection, the swelling, inflammation of the foreskin as well as frenulum. And if any infection occurs in the initial circumcision surgery, and if you have to cover it or cure it with the help of insurance, then that is covered. So one should always know if you have any infection, any injury, any illness that is causing the discomfort in the normal functioning of the penis, as well as the acquired phimosis due to infection, BXO-phimosis, like that is covered. If the frenulum is injured, frenulum is infected or has an inflammation, swelling, tenderness, all these aspects of the diseases are covered under cashless Mediclaim insurance. The second point is the type of insurance. The type of insurance, there are two types. First, individual person purchases the insurance policy, as well as the second one is a corporate. Those people who are working in corporate companies, the insurance is given to them, that is cashless medical insurance, that is also available at our hospital. There are government insurance companies and there are private sector insurance companies. All of them are covered except few the new ones or the few which has to be yet empanelled. So almost 99% of insurances are covered under cashless Mediclaim policy, our hospital in Pune. Then there are network hospitals which are available with our SUNCLINIC, which are empanelled and which are associated with the SUNCLINIC. So now when a patient comes to SUNCLINIC, Dr. Kuber, that is myself, then we do the procedure in the network hospitals who support the cashless Mediclaim policy or who support the cashless Mediclaim insurance. So this is our standard process. So many patients call me and ask me whether your name is SUNCLINIC is not seen in the insurance list that they have, but that is not the case. Our network hospital has a different name and it is covered under cashless Mediclaim policy. So since last many years, more than 10 years, we are doing this cashless Mediclaim insurance surgery for circumcision, frenuloplasty and redo circumcision. So be assured that we have adequate facility of the hospitals which are our network hospitals and affiliated to SUNCLINIC. So on behalf of SUNCLINIC, these hospitals operate and I do surgery, and the insurance part is taken care by our network associated hospitals. The next process is called as pre-authorization process. What we do is we check the patient, and after checking the patient, we prepare a first consultation report or a doctor's report for this pre-authorization process, along with the Aadhaar card photo and your insurance company detail. Either it may be a physical or electronic form of policy number receipt, the card which is given to you by insurance company. So this pre-authorization process is done within 2 to 4 hours. Once you send us the all documents on our WhatsApp helpline, Then we process it further and send to your insurance company for pre-authorization purposes. In this, the all details of the patient medical condition is well explained to the insurance company along with our doctor medical test. And after that, within 2 to 4 hours, insurance company third party application, that is TPA, that sanctions the particular amount. It is different for each individual. Sometimes they give 100% approval, sometimes they give 80% approval, or sometimes they give partial approval. But consider it as a initial approval. Many times what happens, whenever we put a certain charge on the insurance pre-authorization process, they approve only 50% as a interim approval or initial approval. So that means that insurance has given us permission to start the treatment of circumcision or frenuloplasty or the other redo circumcision surgeries or any other surgeries that might be possible. Now, once this approval is received, we have around 7 days within which we can admit the patient and do the surgery. So be sure that you can get admitted same day or next day. Even if you are traveling outside Pune, initially what you can do is take a WhatsApp consultation. In that we check you properly, prepare a doctor's report, as well as we get the documents from you and we send it to insurance for pre-authorization process. This is very helpful when the person is outside Pune. You can certainly help this and you can save the time that we will take the pre-authorization process under our maintenance and insurance. And once this is approved, then you can certainly plan to travel, because it is not emergency. Within 5 to 7 days, you can surely come and get admitted and take the facility of the circumcision. This also covers most of the times the ZSR circumcision, that is a staple circumcision made by ZSR. So we can cover that also. And this is a seamless process. You don't have to go anywhere. You don't have to contact your own insurance company. All details, the pre-authorization letter, as it is sent to the hospital, as it is sent to you also, the insurance company will also notify you how much amount, how much time, and what is the date. Everything will be informed to you so that we are on the same page. There is a complete transparency in this transaction. So this is done very seamlessly. Once the pre-authorization is done, we do few blood and urine tests either out in the clinic or in the hospital, and then we proceed for admission in the hospital. For that, you will have to remain fasting for 3 to 6 hours, as well as you have to bring some attendant with you. Single patients are not accepted in the insurance hospital. So you have to bring somebody with you, either if you are in Pune also or you are from outside Pune also, you can bring somebody. And after that, we will do all the procedure. We do the surgery, and after surgery, within 2 to 4 hours, if the insurance company gives us final approval, then we can send you home. Or sometimes some insurance companies send the final approval letter with all the amounts within 2 hours. Some send within 4 to 6 hours, some send within 24 hours. So depending on your insurance company, you may have to stay 2 hours to 24 hours in the hospital, which is included in your cost. So you don't have to pay extra if you have to stay 24 hours. This is included. So sometimes what happens, insurance company pay 80%, then you will have to pay 20% remaining amount. Sometimes insurance companies pay 100%, then you will not have to pay for the surgery. Only few admin charges and few blood test charges may be required. That depends on person to person. That is completely separate. And this is the procedure which is usually applicable on most of the patients, most of the insurance companies. Few exceptions may be there where we have to change our method, as well as we have to change our approval procedure. But this is the most followed procedure which we do at our clinic. and we do surgery at our network affiliated hospitals where insurance is completely supported, completely accepted, and our insurance team is excellent in quick responses. So you can expect no delay. This is a very successful procedure that we do, and even for normal surgical circumcisions as well as ZSR surgical circumcisions, as well as the frenuloplasty with stitches, without stitches, as well as redo circumcisions, all these are covered under cashless Mediclaim insurance policy. So you can certainly get a benefit if you are staying outside Pune and you want to travel to Pune for this ZSR circumcision, which is original and authentic, but you want to cover it under cashless medical insurance. You can send us WhatsApp. You can take a WhatsApp consultation where we check you properly and prepare the doctor's medical prescription, and then we process to get ahead for the pre-authorization procedure. Even if you have to incur some charges before surgery, even if you have to incur few charges after the surgery, all these will be covered under Mediclaim insurance. So you can send those receipts to your insurance company and they can directly pay you. So this is a cashless Mediclaim policy, as well as we have reimbursement facility also available. We can provide you proper bills and proper discharge summary and all the necessary documentation with stamps and signatures. So if you are in very short time, then you can directly come, do the surgery, make a payment, and you can collect the receipt, and afterwards you can submit it to your insurance company. For that also we support the complete procedure. This is called as reimbursement medical insurance. This is also available at our center. So you can certainly look into it and you can think about it. Now, when you come for a consultation at the clinic, then we will discuss all these things with you, and accordingly you can go ahead and book your surgery as well as proceed for the surgery. So I hope this video is helpful to you. Surely please like, share our video, and please subscribe to our channel so that we will always bring more and more information on these topics to you. Thank you.